Well, good morning, good afternoon, good evening, everyone. I'm Victoria Hammond, PQMD's Community of Practice Manager, and I want to welcome you on behalf of our entire team. And thank you for taking the time to join our open house spotlight on hygiene kits. We're very excited to dig into this excellent resource. But first, I just wanted to very quickly cover a few housekeeping rules. If you could type your name into the chat box to let us know yourself and your organization, and we request that all participants remain muted, but we do invite you to use the chat box for any questions or comments. And just to note that this session is being recorded and will be posted on PQMD's Community of Practice this week. So now I have the pleasure of turning it over to Julie Marie Vanderberg, PQMD's Senior Director of Global Health Policy, who will lead this discussion. Julie Marie, over to you.
Thank you very much, Victoria. And also just one quick request, Victoria, can you also watch the chat for questions in the presentation mode? I don't see that. Okay, thanks. I just wanted to echo a warm welcome to all of our member organizations that are here, our partners, and all the new faces that we see out there today. We are here for PQMD's Spotlight on Hygiene Kit Open House. We're really proud to showcase a novel interactive website and data tools to address important monitoring and evaluation questions around kitting distribution work in low and middle income countries. So today we're going to talk about the tools themselves, why and how we created them. You'll get the opportunity to hear from some people who have used them, and also how you can access them and customize them for your own needs. And then if you'd like to plug into a group, a network of like-minded individuals and organizations who help provide effective kitting responses, you'll have the opportunity to sign up for that today too. Let's see. Okay. This slide shows an easy way to visualize the Spotlight on Hygiene Kit metrics package, and we will discuss each area in more detail. But we have a set of 19 in-depth a la carte evaluation tools that employ both qualitative and quantitative strategies. These tools are meant to guide overall program or partial program evaluation needs. And then we have a complementary monitoring package that enables organizations to track indicators central to kitting programs and to confirm that their current practices are meeting the needs. And then we have developed some guidance along the way and shared some kitting M&E experiences that enabled us to develop new theories of change and action models. And then finally, we have our coalition network, and this is where you can connect with peers and share learnings about best practices. Let's see. Okay, so I kind of went over what's included in the package already, but what's important to highlight here is that we've tried very hard to make everything approachable or consumable immediately by your organizations. We have the tools themselves, the website, they can download the CSV files, or you can share the PFDs for conversation starters. We're trying to make it immediately usable and customizable for you. And but the world of kitting is very big, as you all know. So we also wanted to share really upfront what's not included in this initiative. So other response interventions like cash vouchers or even other types of kits. I will say that with this initiative, we came up with a pretty robust list of the different types of kits. For example, of course, menstrual hygiene management kits or household kits or facility kits. All of those are not addressed with this level, are not adequately addressed with these tools. But there are lots of other resources, and my colleague Beth was going to put some resources from some of our partners into the chat for some of these other kits and initiatives. And of course, if you have resources, please feel free to utilize the chat to share any information. We really want this to be your space as well. And then lastly, of course, the tools may be applicable for other applications, but they were designed specifically for kitting responses in lower and middle income countries. So At a high level, I wanted to first share an overview of the tools, and a bit later we'll get the opportunity, I hope, to dive into kind of the organizing frameworks and how to access all the tools. Our evaluation resources were developed by the coalition and with technical leadership from Tufts University. I know I saw Danielle and her team had registered, and some of them are on the call today. Thanks so much for being here. You'll find qualitative and quantitative approaches to help guide your inquiry and generate data related to kit composition, assembly, transport, storage, safety, distribution, as well as post-distribution insight. Everything is based on that organizing framework I referenced earlier to be approachable and usable from many different vantage points, stakeholder vantage points, and also to be customized so you can utilize it for discrete evaluations or kind of an overall evaluation of your program if you use them as a package. And next, our monitoring package is a management tool that's informed also by industry experts, and it centers on hygiene kitting processes. So in collaboration with Flush, we developed a rational set of indicators for the kitting community to elevate reporting and enable learning about best practices through monitoring their own data. And our approach considered situational, cultural, and contextual awareness and underscores the appropriateness of kitting responses, usefulness of the kits and kit contents, functionality of the infrastructure that you have for kitting, and organizational capacity for best outcomes. Our tools also incorporate beneficiary satisfaction. I'm sorry, my notes are a little, they're cut off on my presentation mode. I'm trying something new today. And levels of coordination among organization and other factors. There we go. And our Spotlight and Hygiene Kit empowers global and local health practitioners with tools while ensuring that you remain accountable to the people who have experienced the emergencies and disasters. We've designed them for anybody with a moderate understanding of database systems and architecture. We hope that you'll find them useful. And they were designed for M&E specialists, database managers, and programs people. So whether your organization has a ton of experience in kitting, or if you're just starting to set up a kitting program, you should be able to find tools that will guide your practices. And if you're looking for, like I said before, a comprehensive evaluation approach, you should be able to use a combination of the tools that you see here, or if you're looking for a discrete evaluation of a part of your process, we're hoping that you'll be able to find something you need here as well. I'm sorry, guys, I'm looking at my notes. So now it's a really good time to share a little bit about the history and why we embarked on this project at PQMD. Our members have such a broad portfolio, but really the secret sauce is in the overlap of activities and intentionalities for our members. And as well as in the complementary and trustful culture that we purposefully curate here at PQMD. So when one of our members asked a really bold question, she said, "Do hygiene kits work? We're all doing it." And you're going to hear from her a little bit later. But a large subset of our members supported the idea that we should really roll up our sleeves and try to figure that out. So hygiene kit distribution, of course, is a legacy strategy that's employed by companies and NGOs and partners to contribute to immediate disaster response and health programming. And hygiene kits, we found, had been identified as one of 8 priority programming areas in emergency response that are highly implemented yet severely underevaluated. This was a study that was done by Tufts, and it prompted our partnership with Tufts to embark on developing these tools. And then we just had an existing evidence gap. There was standardized sector-wide inquiry that was needed to increase best practices and better understand the significance of kitting distribution from multiple perspectives. So then this slide illuminates the heavy emphasis that was on classic reporting at the time. We started this project. We actually had a bit of a break in this project attributable to COVID. We started the coalition prior to COVID, and now we're just so excited that the momentum is back and we're able to represent these tools. But you can see here that the emphasis was really on throughput metrics that reported basically on activities and outputs. And these findings, this was from a survey that we had done to confirm the interest in working together on this project. So, and you can see some companies certainly and organizations certainly did measure more information that would be considered along the impact results, but they were not systematic, and there certainly was no public repository or information to tap into to allow kitting practices to be improved. So PQMD members really wanted to understand the dynamics around what makes kitting responses more or most effective and who defined that success. So with the support of Johnson and the Johnson & Johnson Foundation, we formed a coalition and started to develop the Spotlight and Hygiene Kit tools. The coalition really prioritized shared understanding of current best practices in hygiene kitting, shared information about what it was really happening at the time on monitoring for hygiene kit programs, and articulated common areas of need or common barriers that would affect kitting practices. Evaluation efforts in a multi-sector approach, understanding that you had lots of different stakeholders involved in kitting, and access to public monitoring and evaluation information from experts employing hygiene kit responses. Advancing, there we go. So this is a snapshot of the coalition and advisory members who worked with us. PQMD enjoys a deep and varied network. We're so fortunate to have an international and local healthcare corporations, agencies, and technical experts to have worked together with us on this initiative. Not all of these organizations are PQMD members, nor were they all involved in every step of developing the tools. And as I mentioned before, we did get derailed by COVID a little bit, but during a public call for interest to pilot our tools, 60% of the respondents who wanted to pilot them were local NGOs, local universities, and companies and governments. So now we're going to take a minute, and I'm going to stop sharing my screen. We're going to turn it over to two of the coalition members. I have the pleasure of introducing Brian Sink, who's the Vice President of PowerServe at Heart to Heart International. And then after that, we'll hear from Kim Keller. She works with the Global Community Impact in disaster response, resilience, and product donation. And she's now a part of the new Global Health and Equity team at Johnson & Johnson.
Thank you, Julie Marie. If you want to stop sharing.
Okay.
Some slides. As Julie Marie indicated, my name is Brian Sink, and I oversee the Hygiene Kit program at Heart to Heart International. And just by way of establishing some context for the information that I'm going to share with you, let me first tell you a bit about what you've got the context. So Heart to Heart International, it's a global humanitarian relief organization, and our mission is medical. And so simply put, we send medicine, medical supplies, and medical care in the form of volunteer doctors, nurses, EMTs to people that are in need. And they're generally folks that have been impacted by a man-made or natural disaster. In addition to that, we've got a fairly robust community health program, which involves education as well as an effort in concert with Becton Dickinson to establish point-of-care diagnostic laboratories in CNET clinics throughout the United States. So we've been doing this work for about 32 years. We've worked in over 130 countries and distributed over 2.6 billion in medicines and medical supplies. We elected to use some of the tools that were developed, Spotlight on Hygiene Kit, to determine the effectiveness of our Hygiene Kit response in Ukraine and also countries that were supporting IDP. And we did that for two reasons. One, we anticipated that this would be a particular response that was lengthy in nature and it would require a lot of our resources. And so it made sense to gather some information for us to make us better at what we do. And so to reinforce that, you can see this is our distribution of kits in 2023, and you can see over 1/5 went to Ukraine, and that percentage was actually higher back in 2022. So it required a lot of our focus and a lot of our bandwidth, and so it really made it important for us to understand how well we were doing in the operating theater. And so by way of background, so we used the surveying tool, but we used it for one part of the constituency. So we reached out to distribution partners. Heart to Heart is, while we work globally, as well as in the US, we're small. We're about 54 people on staff, and so we're largely volunteers. And so we were leveraging distribution partners in Ukraine, as well as Poland and Romania, to distribute our items. And this is a complement to a broader response, which included medicines, medical supplies, and modular medical clinics, which were converted 20-foot cargo containers. And so we leveraged partners we were working with to gather data. We probably had around a dozen partners total, but we surveyed 5 at this time. They gathered data from 16 different locations throughout Ukraine. And we did this for a period of about 10 months. So it was fairly comprehensive in nature. The particular kit in question, this probably represented about 80% to 90% of the kits that we sent over there. It was a very basic personal hygiene kit. And so it included hand towel, washcloth, soap, shampoo, toothpaste, toothbrush, nail clipper, comb, even a hand washing plier. So nothing spectacular about it. But part of why we sent this is what we had in inventory at the time that the conflict first started. So it represented quite a few of the kits that we sent over there. So as I mentioned, we leveraged the Spotlight on Hygiene Kit tool to inform what survey questions we should ask the distributors of those kits. And so 2 key learnings from this as you start out. First is there's sort of a statistical anomaly when you're distributing to people that are recipients of aid, and it's called a courtesy bias. And so there's a certain politeness factor wherein maybe the ultimate kit recipients and those that are distributing are grateful for what you've sent them, and they don't want to necessarily give you all the constructive feedback that you wish to have. And so you need to take that into account. And the other thing that you need to bring to the table is a certain amount of humility, because you're going to learn some things about your program that are constructive in nature. And so you need to be able to take that and make use of it and not just let it hurt your feelings. And so I'm going to just share a couple excerpts from the survey questions and survey results with you here to just kind of highlight the value of the data that we secured. And so the first is very high level. We just ask, are the kits useful to the beneficiaries? And we got good data, right? 80% of the folks said it's very useful, 20% useful. And so there's a quote from one of the respondents here. And so if we stopped right there, we would have probably left the exercise saying, oh, okay, our kits are fine, let's just send more. But the tool is not going to, allow you to do that. It gives you options to peel back the layers of the onions and learn more. And so, next question we asked was, do any of the kit contents or the packaging warrant reconsideration? And so, relatively high marks, but not as much as the first question. So, 60% of the folks didn't think any changes were required, but 40% had something additional to say to us. And so, what was that? So, we heard a couple partners indicate to us that people were requesting larger size shampoo. They wanted us to substitute the comb and nail clipper that was in the kit with pads and tampons, add laundry detergent that was suitable for hand washing of clothing, and then also package all of this in a smaller outside drawstring bag than we were using. And so this required some deliberation on our part. And so this prompted us to go back and ask some additional questions that weren't in the original survey. And so what were the circumstances where people wanted larger shampoo bottles? And so our existing bottle is 4 ounces. And so, for me, that's going to, last 3 or 4 weeks. But, there are a lot of people that we were distributing to that had much longer hair, and it wasn't lasting nearly that long. And so we went back and investigated the proposition of including, an 8 to 12 ounce bottle in there. And so, more weight, higher cost and whatnot. And so we ultimately, in the near term, made a decision to advise our distribution partners to give multiple kits to individuals that had the need for more shampoo versus putting the larger bottle in there. And that was an economic decision. Second part, pads and tampons. Now, this didn't come as a surprise to us. We knew the demographics of Ukraine and what would be needed. But again, we shipped out kits that had previously been made as part of our initial response. And so those did not have pads and tampons in it. But what we did is we pivoted and we included pads and tampons in some of the subsequent shipments. And so the guidance that we had gotten from our logistics partners that were actually doing the in the field distribution was included in the shipment, but do not include it inside the packaging of the kit. And the reason for that, it was going to create some logistics challenges of having multiple kit types in the field to have to figure out inventory for and distribution by kit type. Whereas if the items were separate, but in the same geographic arena, they could give everybody the same kit and then decide who got the feminine hygiene products. And so we were compliant with that request. And then for the small drawstring bags, we did peel back the layers of the onion and determined that there was a larger contingent of persons that wanted us to keep the outside bag the same because they were using it for utilitarian purposes long after the hygiene items had been depleted. So it was serving as a proxy for a purse or a waterproof container or something of that nature. So we ended up keeping that the same, but really informative feedback for us. And we would have preferred to have made more changes, but there were environmental and economic factors in play along with timing that didn't make that plausible for us in the early stages. Another question that we asked was about the cultural fit of the kit. So, one of the basic tenets of humanitarianism is to ensure that we are culturally conscious of what's going on. And so we asked this question and, to mixed reviews, 60% said it was, very good culturally. And then the other 40% were saying that it was almost culturally a good fit. And so we didn't get enough information out of the way that I asked the question in the tool. There was a place for comments, but we didn't get enough meat on the bone. But because we asked this question and we know who answered it, we knew who to go back to and have the conversation with. And so what we learned from that were several things. So one is we include hand washing instructions in our baseline kit, and it's about how to properly wash your hands, but more importantly, when to wash your hands. And this makes a great deal of sense when you're distributing in non-industrialized communities that maybe aren't as educated. Sending this into Ukraine was perhaps not best practice. It was probably useful in some of the more agrarian communities, but writ large, I think some people took offense to having them in there. Ukraine is an industrialized nation that's highly educated, and so and the way in which the hand washing instructions are written are instructive in nature. And culturally in Ukraine, instruction is appreciated more when it comes from somebody that they know and somebody that has credibility. And it's often offered in a more guidance oriented or suggestion oriented way. And so not something we knew on the front end, but something that we learn on the back end. The other piece of information was the menstrual product distribution. And so that decision that we had made to distribute the menstrual products independent of the kits actually had a downside to it. It was very effective from a distribution standpoint, but culturally, menstruation is not talked about or shown as liberally in Ukraine as it is in the United States. And so the fact that the feminine hygiene products weren't inside the kit where folks couldn't necessarily see them presented some angst or a bit of hesitation in going up and getting those items that were sitting out on a table packaged separately, and you could see what those were. And so in subsequent shipments, we did take hand washing instruction out when we knew that those particular assemblies were destined for Ukraine. And we also advised our distribution partners that they needed to, in a more discreet fashion, make sure that people knew that those products were available, but not make a production out of it. So those were some nice pivots that we were afforded by virtue of him. Another baseline question that we thought we knew the answer to, are the kits getting into the operating theater in a timely fashion? 80% yes, 20% indicated that they were a little bit late. There were a couple of contributors to that. And so so essentially they're shipping delays. And so some are created by the method of transport, right? Some of the aid that we shipped over there were shipped via air. So got there very quickly and we didn't have complaints about that. But for economic reasons, much of what we sent over were sent over in containers and cargo ships. And that, really elongates the time in transit. And so this prompted us to think about ways to still preserve the economic integrity of the program, but also get kits in there in a timely fashion. So that prompted us to ship in larger batches and on a very routine cadence that is designed that a subsequent shipment arrives at the time that the previous shipment is about depleted. And so while you're using a slower route because you're refreshing so frequently, it's really not noticed. We also got creative in the way that we shipped things over in combining it with other components of our response. And so I'll share a couple pictures of that here. So I mentioned to you modular clinics before. That was part of our response. So they're converted 20-foot cargo containers that can serve as ER trauma units, primary care units, lab units, maternal care units. And so they can operate off the grid with solar arrays, and you can practice medicine from them. And so with the exception of the equipment that's inside, it's largely airspace. So what we started to do is to ship other forms of aid inside that cargo container over. So we were kind of saving on freight charges, but also solving the the challenge of getting things in on a routine cadence, because we've got, I think, 15 or 16 of these deployed throughout Ukraine right now. And so it was an opportunity to send kits over in them. And then in the lower left-hand corner, you can see one of the emergency operation centers with the kits that we shipped over, and categorizing them and positioning them in concert with other aid that was distributed from that item. So again, the tool helps us have the data to make these more informed decisions. So what conclusions have we drawn? And so first, I'll say that I am not an advanced practitioner of all of the tools that the program has to offer. We obviously started using this over 2 years ago, and this was after the coalition had met and we had everything roughed out and a lot of the tools available. But Julie Marie and her team have since organized this in a much more convenient way to use. And so that's awesome. And we will be digging in more as we survey the recipient community directly. And we also have ongoing surveys that we do for those that do the actual kitting practices, because there are many constituents in the process from which we want to gather data. So first conclusion is that the data was valuable to us. As you could tell, we were able to make some pivots. Those decisions enabled us to improve the distribution process and ultimately the efficacy of the kits in the operating arena. And then also looking at it from the other end of the spectrum about our sponsor partners, many of whom are on the call today. We put ourselves in a position where we were able to share not just output information, but information. So every year, poor Kim Keller gets a report from me that says how many kits I sent to different areas of the United States and the world. And that's out there. And it's nice to have. It really is. But there's more meat on the bone there to share if you go out and get it. And that's the great thing about the program. So we're now able to communicate. This is the percentage of kit recipients that were able to continue their previous hygiene regimen that would have otherwise not been able to, post-conflict or post-natural disaster, something of that nature. So, this is the percentage of individuals that were connected to other resources outside of hygiene items by virtue of coming to get a kit. We were able to connect them to transportation or medical care or food or shelter or those things. And so that's a much more comprehensive story to share with folks that we're grateful for, right? It's not just about improving our program, but sharing what we've learned with others. And so lastly, I'll say that there's an investment to using the tool, and we find that the return from that investment is good, but you've got to roll up your sleeves and get to know the tools that Julie Marie talked about before and study up how to use them, and preferably talk with other coalition members and then learn from the results that you get and take action. So really grateful for having the program. It's provided some insight to us that we wouldn't have had. And I'll also say that, when we get to the end of the session, we'll be putting a call out to join a working group in this space. And, we started with that some years ago with the coalition. And I'll say that there's nothing like sitting down in a room with people that are in the same ecosystem that you are, to commiserate, to learn from them. It's actually kind of a cathartic experience to know that there are others out there that are experiencing the same challenges. So when we get to that point, just know that I'm certainly a promoter of that and fully endorse that. I've learned a lot from those of you on the call. Really appreciate that. So with that, I'm gonna it's a blessing for me to turn it over to Kim Keller from Johnson & Johnson. She's been a big supporter of the SOHK program and our hygiene kit program at Heart to Heart. So Kim, thank you much.
Thank you, Brian. Thank you, Julie Marie. So I'm Kim Keller, and I work for Johnson & Johnson, and I have global responsibility for disaster response, resilience, and product donations. So hygiene kits have always been a part of our work. For those of you who follow the world, J&J no longer has consumer products, which is how we built our hygiene kit program. However, we remain committed to providing cash to Heart to provide hygiene kits for use and for opportunities with our employees to kit and other people to kit them. So you've heard great information from Brian about why nonprofits would find this valuable and why that this is really important for nonprofits and recipients. But why would a corporate member care? Yes, I love getting more detailed information from Brian about where and how our hygiene kits are making a difference. But from my perspective, the question was still why? Why, as a corporate member, do I care? And some of the things that we had talked about before this process was it's an opportunity to bring people in disaster sense care because they come to a shelter or they come to a clinic because they need something after a disaster, after being displaced, and they're looking for food or water or basic hygiene supplies, and they get brought into care. How do we engage our employees internally who are doing kitting events? And what does that give us other than just a large team building opportunity? So there are tools within the Spotlight on Hygiene Kit toolkit that talk to what are the other implications of hygiene kits. Brian didn't get into that beyond the detail of how it can be used to really shift and change the thought process of the kit itself. But how do we show that it does bring people into care and it provides that touch point for care that they may not have ever had? Maybe not Ukraine, because Ukraine is a developed country, they all had access to healthcare. But when you're talking about some other places in the world where we've sent hygiene kits for Ebola or COVID or other things, that might be a more important access to care point. And when you look at it from a corporate perspective, not only am I interested in how our employees feel about being engaged in a hygiene kit opportunity and the data that we can provide back to them, but I love how Brian walked through the changes to the kit and the packaging and the thought processes around that, because we've struggled. We've had long conversations with Heart to Heart when we had consumer products. Do we include tampons? Do we include sanitary protection? How do we manage that? How do we ship it? And Brian now has data. It's not just us sitting in a room thinking about it. There's data now to talk about. Well, it is complicated to segregate different kinds of kits, but it may be more culturally appropriate to do that than giving them straight out to people who aren't willing to come forward and pick them up because of cultural sensitivity. So it's just really interesting. And I love that the decision around the larger bottles of shampoo can be made strategically and not just because somebody said or because we think it's an issue from a financial perspective. We thought about it. We talked about it. We made a decision, and now we know how to move forward. And it just makes everybody feel better about what they're doing. It's not just throwing hygiene kits out the door. So we've been pleased to be part of this program and the collective engagement of the teams. I mean, it's mostly been nonprofits other than Henry Schein. So I would really encourage some of the corporates, whether you have consumer products or not, whether you do hygiene kits or not, as donors, I know a lot of you do engagement with your employees. So the opportunity there is for you to provide more feedback to your employees on what good your kits have done that you've packed, and how your employees feel about it, and how you might alter or change your own engagement in the opportunities because of the feedback for them. So I look forward to the continuing coalition. Brian, if you want me to sit on the coalition, I will. I'm always interested to learn and grow. I do get your reports and I love them because I share them internally, and we love our storytelling opportunities. So thank you, and on to Julie Marie, but I'm open to questions at the end if there are any. Thanks.
There we go. Thank you both. That's wonderful to hear. And as Danielle put into the chat, it's just really good to see people starting to use the data and the tools and pivot based on data that they're getting. I did want to share that we're very aware that we're missing sort of a second perspective of this. I think I had indicated that through this coalition, we were able to develop a novel theory of change around kitting. And what's unique about this is that we really understood that there's kind of two different perspectives in kitting, sort of the traditional responder level, people distributing, and the models are quite different. And we have a report that articulates these differences in models, but yet they can work together. So if you are looking at this theory of change, which is a little bit complex. Basically, the highlights here are that you can be somebody who's doing the entire thing from, sourcing and building the kits all the way through kind of distribution at a regional or local level. Or you could be just creating the kits and then working with your partners, rely on your partners for distributing them. Also there are, of course, traditional responding organizations that source and everything locally. The kits are built more by staff rather than volunteers and then distributed as a part of a larger response. So I guess we wanted to share this at this point because we are also aware in our presentation today, we don't have that sort of responder perspective highlighted here yet, but we're very hopeful that the next time we all get together, some people will be able to share their experience in using the tools. Again, this was a strategic shift for us after COVID. Instead of trialing all the tools, we really wanted to present them in the state that they're in and allow everybody to kind of collectively work together through them. So next, this is your opportunity to go ahead and join us. We'd love for you to join. We're going to stand up quarterly meetings and discussion sessions where Brian is going to chair those, and we're going to work through different issues in kitting, whether it is working through the tools. And also on this job form, if you go ahead and you can scan the QR code, it'll take you to a form where you can indicate if you'd like to be on the working group or if you'd like to just get more information about the tools. If you would like to have a training on the tools, please put that in there. This will help us to better understand what comes next. And I think Beth will be putting that link also in the chat. I'm going to move on with the slide. A different thing we'd love to see is if you actually, I'm going to come back to this because you guys might still be entering in information. We'll come back to that question in a second. But really quick, I wanted to kind of look at our overarching framework that we talked about in terms of how these tools are organized. So the evaluation tools really are kind of put onto the overarching general context. And so there are some questions about that, but our gut feeling is that organizations that are doing this often, they also have their own needs assessment and general context surveys to be able to understand how to enter into a response. And so this is those guidance questions are really, if you're new to the area, starting fresh, the minimums that you should certainly consider. But then where it really gets interesting here is we've divided all of the qualitative and quantitative surveys into these kind of areas: composition of your kit, assembly of your kit, transportation, how you get it to where it should be, and then distribution and post-distribution information. So in the composition phase, it really encompasses what's included in the kits, how decisions are made to include items in the kit, and then how they're procured as well. And again, these can be utilized whether you're what we termed as a kitter or a responder. And then kit assembly phase really looks at where the kits are assembled and stored, how the decisions are made about the about the storage and security, and feedback from the people who are doing the assembly. And then transportation, how are the kits transported between various locations, feedback forms from the people who are doing that transportation. And then distribution, we looked at how distribution occurs, and including how beneficiaries are identified to receive the kits, how distribution is managed and ensured to be safe, observations of the distribution, and understanding how decisions are made about distribution. And then feedback from those who are actually doing the distributions. And then post-distribution really looks into feedback from those who received the hygiene kits. There's individual surveys, there's focus group discussion guides, there's key informant interviews with community leaders or beneficiaries. So as you can see, there's we've tried to look at the different parts of the kitting process and give people at the very least conversation starters, and at the at the highest level on the Spotlight and Hygiene Kit tool. I don't know if you guys have gotten a chance to get on there, but please go ahead and do so. You can see that we've provided PFD files of all of these surveys if you just want to download them and utilize them to start conversations, or there's CSV files, which you can download and hopefully just check the titles, the column titles, to make sure that they work with your database system, but you should be able to upload them into your own data systems, whether it's SurveyMonkey or something else that you use, and to get started on that. Let's see here. And then our monitoring tool, it's in mWater, which is really exciting because you can just log on and you should search for PQMD Hygiene Kit monitoring tool, and it's an open access tool for people to be able to utilize. However, people who are much smarter than me understand all the benefits of working in mWater, and we certainly can provide a training on that separately if people are interested. But it really does enable you to be able to track your kitting practices, over multiple responses or multiple partners. And again, this is looking more at the processes that are involved in kits. Kind of, were the hygiene content kits the right elements? Did they work? We utilize a theory here of contextual fit. So the match between elements of an intervention, the values and needs and resources of the implementers and the beneficiaries. It's something that's previously been used a lot in education, and we thought it was a good match to be able to utilize to monitor hygiene kitting programs. So mWater, like I said, has the capacity to track responses collectively and see the results on a console. PQMD is really interested in this as kind of a next phase of interorganizational learning. So definitely that's another area if you wanted to contact me about if you're interested in doing this, or if you want to set up your own console and track your progress with your partners. It should be ready for you to be able to do that. And hopefully you'll come to our working group and share your experiences. I'm going to go to this last question now that maybe you've already entered in your information into the coalition working group, and looking at if you wanted to use your smartphone, your phone, to scan the QR code, it'll take you to a Slido question. We're just trying to gather from this group of practitioners here, like, what are the hygiene kitting topics that you would like to discuss with your peers or with the working group, to kind of give us some guidance for that first agenda for the first working group meeting after this. So please feel free to go on and put your results in there. I will share the results, and also wanted to see if anybody had any questions, if there's anything people wanted to discuss further. And I'll just leave this up for a minute to make sure that people can be able to access the question. We're really excited to see so many people here. And so many people from a broader network as well. If you've had experience using the kits, I do see that there's a number of the coalition members here. And like I said, we had started this pre-COVID, so a lot of people have actually transitioned, although the organizations may not have. I'm going to stop share and start to share the other. Keep entering. I'm seeing a lot of really great responses come in. So while you're putting in those responses, for those of you who haven't had the chance to jump on here yet, this is the website. It's at PQMD Hygiene Kits .org. And so if you come on down, you'll be able to look at all of these different sections about our work, what we know about kitting. The frameworks are all in here. What the PQMD Spotlight tools are and who are they for. Some of the things we haven't been able to talk about here for a lack of time is the lessons learned from the coalition. That's something else that we'd be very happy to discuss with everybody. The evaluation tools, monitoring tools, decision trees, and we just tried to make it easier for you guys to know where to start with some of these things, and of course, opportunities to stay involved. But for example, if you go into the evaluation section, you'll see here, this just come on down and you can access any of the individual surveys in 2 formats. And let's see really quickly, I'm going to share this other on the MWater portal itself. Can you guys see that? Yeah, it's behind my other windows. Here we go. So in the MWater portal itself, everything's entered in and you just have to create your profile, and then if there's guidance before every question that helps you to understand kind of our logic and rationale in asking those questions, so you can go on down and fill in the information. The coalition recommended that within 2 to 4 weeks of delivery of your kits, you would fill this information in. I know I'm going quite quickly, but I just wanted to show that a little bit. And then lastly, I'm going to share what you guys are saying we want to talk about here. I think it's this one. Yeah, okay. And if there are any questions or comments in the chat, thank you everybody for the positive feedback. I'm just scrolling through the chat really quickly. This is great. This is great. Fantastic. Thank you very much. And thank you, Kimmy. I see we'll be in touch. I'm really excited about the next steps on this project. And if you've been able to if you hadn't been able to fill out the working group request, or if you have other colleagues that would like to do it, please feel free to forward the information. I will go ahead and plop this presentation, the slides and everything right onto the Spotlight and Hygiene Kit website, so you guys can always find everything we just talked about. With that, I wanted to thank people, and we'll be able to give you a few minutes before your next meeting of the day.
Great. Thanks everybody for joining. And for those of us, we'll hopefully be welcoming you in the end of April and May to PQMD's Global Health Policy Forum, which will be in New York City. You should have received registration information in your inbox. And if you have not, just let us know and we will be happy to forward you those details.